Why I Work Alone in Medical Research, Part 1, number 1587, the 5th of April 2026, Gerald C. EclaireMD Foundation, Category, Medicine Research. Preface: My academic background includes mathematics, computer science, physics, engineering, and business management. Later, I spent 9 years self-studying psychology and personality disorders during 2001 to 2009 and wrote approximately 200 psychology research papers. This effort was followed by another 7 years of intensive self-study in internal medicine during 2010 to 2016, at a rate of 13 to 14 hours per day, 365 days per year, without interruption. In 2017, I spent an entire year writing a very short 228-word paper on type 2 diabetes management. That paper was selected by WHO and presented at its biannual IDF conference on the 6th of December 2017 in Abu Dhabi, UAE. This experience reinforced my belief that the importance of research lies in the value of its content, not in the length of the paper. Since then, I have written and published approximately 1,586 medical research papers covering many chronic conditions and mortality diseases. All of my research work has been conducted independently, without institutional funding, guidance from medical professors, assistance from colleagues or graduate students, or university affiliation. This article reviews my past work experiences and learning process across multiple disciplines in order to explain why I eventually chose an independent and solo medical research path. The primary objective of this paper is to explain why an independent, solo research environment can improve research efficiency and depth of insight when sufficient long-term data preparation exists. Mathematical models such as TSI and other analytical tools presented in this article serve mainly as illustrative examples demonstrating the practical outcomes of this research environment. Structure and approach, rather than the central focus of the discussion. Introduction. During my master's and PhD training years, I functioned essentially as a research assistant to my advisors. My responsibilities included data collection, compilation, numerical calculations, and technical implementation. At that stage, my primary focus was learning knowledge. When I became an entry-level engineer in industry, my role remained similar, except that mainframe computers replaced handheld calculators. Meeting project deadlines became the top priority. After promotion to engineering leader and supervisor, my work shifted toward people management, scheduling, coordination, and planning. Meeting corporate objectives became my main responsibility. At Sun Microsystems, I served as Senior Director of Graphics Processing Unit GPU software development, managing approximately 200 engineers. During the period, I learned how complex high-tech products are built through coordination of large teams working on tightly coupled technical components. At Cadence, as Integrated Circuits Division President, my responsibilities expanded to include financial performance, market strategy, and corporate positioning. One negative memory from this period was corporate politics. In my view, internal politics often consumes time and energy without contributing directly to technological innovation or business growth. However, within large organizations, such activities are often unavoidable due to human nature. At Avant Corporation, as the founder and CEO, business survival, financial growth, and capital market performance became the dominant pressures. Internal corporate politics largely disappeared because I was the founder and boss. However, I never viewed leadership as dictatorship. My most meaningful memories from that period were not the financial success of the IPO or NASDAQ performance, but rather the daily evening R&D meetings from 21 o'clock to 23 o'clock with the highly talented engineers, whom I personally recruited from 5 top engineering and computer science universities worldwide. Those meetings involved intense technical discussions, brainstorming, disagreement, meaningful debates, and collective problem solving. Through these interactions, I learned that key challenge is how to integrate many intelligent individuals into a coordinated system. Similar to connecting many powerful computers into a supercomputer, this experience strengthened my systems thinking mindset. However, I also felt some regret that my administrative responsibilities prevented chances of deeper personal learning of semiconductor chip design details. This background reflects my long-term cognitive habit of viewing complex problems as interacting systems. Semiconductor design gives interacting functional modules. Neural networks gives interconnected nodes forming intelligence. Biomedical system gives interacting physiological variables forming disease trajectory. I naturally think in network structures rather than isolated input and output variables. This same perspective later guided the structure of my medical research work. Natural bridge to my solo medical research style. My career trajectory logically explains why I eventually chose independent medical research. Large teams introduce integration complexity. Corporate structures introduce administrative overhead. Independent work allows faster iteration and deeper concentration. Therefore, choosing a solo research structure represents a natural continuation of my previous professional evolution. In 2010, after deciding to self-study medicine, I initially attempted to follow the high-tech venture model that had been familiar to me. I built a 7-person team, including one MD from UCSF with an annual salary of $240,000. However, after approximately 1 year, I realized this approach was a mistake. Instead of learning medicine deeply, I found myself acting as a CEO again, spending substantial time managing personnel issues, coordination tasks, and organizational structure. These activities reduce the time available for direct knowledge acquisition. Therefore, after 2011, at age 64, I decided to adopt a fully independent research approach and restart from ground zero. Similar to when I became a Silicon Valley high-tech entrepreneur in 1981 at age 34. This solo approach meant no funding, no institution, no medical school, no classroom, no professor, no classmates, no colleague, no assistants. I did not rely on traditional textbooks. Instead, I read more than 10,000 published medical research papers available online. I had no external patients and no physical laboratory. I became my own patient, and my body became my only available laboratory. My core assumption was simple. From a macro perspective, human physiology is largely similar across ethnic groups, including Caucasian, Black, and Asian populations. From a micro perspective, individual pathological details may differ, but underlying physiological mechanisms remain highly comparable. I had not studied biology after the first year of high school, yet this belief became the foundation of my decision to pursue independent medical research. My logic is internally consistent. From engineering training gives system thinking, from large team leadership gives integration complexity, from CEO experience gives administrative overhead. From desire to learn medicine deeply gives need uninterrupted time to understand my own diseases. Therefore, the solo research approach becomes optimal at this stage of my life. In some sense, this path resembles the independent scientific style used by Isaac Newton approximately 400 years ago. Long preparation before high output. One reason I was able to produce approximately 1,600 papers within 9.3 years, 2017-2006, is that the preparation phase began decades earlier. My formal training in mathematics, engineering mechanics, dynamic plasticity, artificial intelligence, and system modeling provided a large set of conceptual tools before I began writing biomedical research papers. My background in dynamic plastic structural mechanics, especially the concepts of strain, stress, viscosity, elasticity, plasticity, fatigue, and failure mechanisms, strongly influenced how I later interpreted different disease processes. Instead of viewing disease purely as a statistical phenomenon, I tend to interpret pathophysiology as a nonlinear and dynamic system involving interaction, and adaptation, threshold crossing, progressive damage. Another major advantage is the availability of a long-term personal longitudinal dataset. Since 2003, I have continuously developed a medical AI software system on my iPhone and collected more than 4 meters. Billions data points related to detailed pathophysiological and lifestyle detailed data, including glucose values, blood pressure, body weight, food intake, and qualitative physical activity, sleep hours and patterns, stress patterns, and intensity over 17 years. This dataset accumulated to more than 4 million data points. This 4 millions dataset allows repeated hypothesis testing without waiting for external data collection cycles through human labor or institutional approval processes. In addition, many of my papers are not isolated independent studies, but progressive refinements of a consistent system framework. The main challenge I faced was selecting the most appropriate research methodology, starting from mathematics and physics tools, including time, space, and frequency domains, followed by viscoplastic energy methods, supplemented by geometry, topology, and stochastic probability of failure. Once a base structure is defined, different papers examine different dynamic properties of the same system, such as level behavior, rate of change of velocity, acceleration, and jerk stability patterns. Recovery behavior. Many different diseases share similar structural characteristics in terms of cumulative loading and triggering mechanisms. Independence from institutional constraints also contributes to a higher productivity, without the need for research grant applications, committee reviews, multi-author coordination, journal gatekeeper delays, and repeated revisions, or travel to attend medical conferences. My research iteration becomes faster, more efficient, and continuous. Of course, the sense of loneliness must be self-managed and overcome. The overall workflow becomes similar to engineering-style iterative modeling. This is part 1.